If you are over 60 and you have ever woken up around 2, 3, or 4 in the morning with a sudden cramp in your calf, I want you to listen very carefully to what I am about to say. Because the most dangerous mistake older adults make with nighttime leg pain is assuming it is just a magnesium problem. They stretch the leg, they rub the muscle, they take a supplement from the nightstand, they wait for it to pass, and then they go back to sleep, believing the problem was a harmless muscle spasm. Sometimes it is. But sometimes it is not a simple cramp at all. Sometimes the first warning that blood in the leg has been slowing down, pooling, and sitting still long enough to create the exact conditions that make a clot more likely to form. And what makes this especially dangerous is that it often happens in the quietest hours of the night, when no one is looking, when the pain seems temporary, and when the explanation feels easy. A person wakes up at 3-7 in the morning with a sharp, gripping pain in one calf. By 3:20, the pain is less intense. By breakfast, they tell themselves it was only a cramp. A week later, that same person is in an emergency room with shortness of breath, because the real problem was never magnesium. The real problem was circulation. That is what this video is about. Today I am going to show you why calf pain that appears in the middle of the night becomes more physiologically important after 60, what the body is actually doing while you sleep, how to tell the difference between an ordinary muscle cramp and a possible circulation warning, and what simple habits can reduce the conditions that make these episodes more likely. And I want you to stay with me all the way through, because the fourth section is where I am going to explain the part most people have never been taught, why the calf is often called the second heart, and why it goes functionally silent at night. Once you understand that mechanism, you will never hear the phrase, just a night cramp, the same way again. Let me start with a woman I will call Margaret. Margaret was 68 years old, retired, organized, the healthy by most people's standards, and living alone with a small dog in a quiet neighborhood. Her blood pressure was controlled. She was not bedridden. She was not what most people would think of as high risk. If you met her, you would have described her as independent, active, and sensible. In late winter, she came down with a respiratory illness. Nothing dramatic, no ambulance, no hospitalization. But for 5 or 6 days, she moved much less than normal. She spent more time on the couch, more time in bed, and less time walking. She also drank less water than usual, because she did not feel well and did not want to keep getting up during the night. Then one Tuesday morning, a little after 3, she woke up with a sharp pain in her left calf. It felt like a cramp. She did what almost everyone over 60 does. She pointed her toes upward, rubbed the muscle, sat for a moment, swallowed a magnesium tablet, and once the worst of the pain passed, she went back to sleep. The next morning the calf still felt off, not violently painful, not enough to panic her, just heavy, tight, slightly sore in a way that made her think perhaps the muscle had seized harder than usual. Later that day she noticed the left sock left a deeper mark around the ankle than the right one. By the end of the week, the calf felt warmer than the other side. She still did not act, because this is what the body does so effectively when it wants to be ignored. It produces signals strong enough to be real, but not always dramatic enough to feel urgent. On day 11, Margaret became suddenly short of breath while standing in her kitchen. She felt a sharp pain when she inhaled. At the hospital, imaging showed a clot in the calf and another clot in the lungs. She survived, but what nearly killed her did not begin in the emergency room. It began at 3 in the morning, with a pain she explained away as a mineral problem. That story matters because it contains nearly all the ingredients that make these episodes more common after 60. the less movement, overnight dehydration, aging veins, reduced calf pumping, and a nervous system that is far too willing to accept the word cramp as a complete explanation. So let's talk about the physiology in plain language. Your legs have a circulation problem that your arms do not a disease problem, a gravity problem. Your heart can push blood down to your feet with force. But getting that blood back up is harder because the return trip from the lower leg to the heart has to move uphill against gravity through a lower pressure system. And that return is not handled by the heart alone. It depends on three things. First, it depends on the veins in the legs staying open and unobstructed. Second, it depends on tiny one-way valves inside those veins, the little flaps that open to let blood move upward and close to stop it from slipping backward. Third, and most importantly for this conversation, it depends on the calf muscles squeezing over and over again as you walk, shift weight, climb stairs, rise from a chair, and move through your day. Every time the calf contracts, it compresses the deep veins inside the leg and pushes blood upward. That is why vascular specialists often refer to the calf as the second heart. It is not just a poetic phrase, it is functional anatomy. The calf is an active pump. Now here is what changes after 60. The vein valves are not as tight as they once were. The vessel walls are not as elastic as they once were. Many people move less than they did at 40. More time is spent sitting. More time is spent recovering after illness. More time is spent sleeping in fixed positions. And even when a person is relatively healthy, blood flow in the legs tends to become less efficient with age. Then nighttime arrives, you lie down, you stop walking, you stop shifting, you stop using the calf pump. For 6, 7, or 8 hours, the second heart goes mostly quiet. That matters because when blood in the lower legs moves more slowly, the veins lose one of their most important protective forces. Flow itself, moving blood protects the body. Stagnant blood invites trouble. This principle has been understood in medicine for more than a century. One of the basic frameworks for clot formation is something called Virchow's triad: slow blood flow, changes in the vessel wall, and blood that is more likely to clot. Older adults often drift toward all three at once. Movement declines, so blood slows. Veins and vessels age, so the surfaces are less ideal. Illness, dehydration, inflammation, surgery, travel, medications, and certain chronic conditions can all make the blood more willing to clot. And the hours around 3 in the morning are where several of those forces overlap. You have now been still for hours. You have taken in no fluids for much of the night. A little water has been lost through breathing and perspiration. The calf muscles have not been pumping. The blood in the lower legs is moving at its slowest pace of the day. That does not mean every 3 a.m. calf cramp is a blood clot. It does mean that nighttime calf symptoms deserve more respect after 60 than people usually give them. Now let me explain something else most internet articles get wrong. They reduce the entire problem to electrolytes. They say you're calf cramp because you need magnesium, or potassium, or bananas, or pickle juice, or some magical bedtime mineral routine. And while true deficiencies can exist, that explanation is often far too shallow for what is happening in older legs, because a lot of nighttime calf pain is not simply about a missing nutrient. It is about an irritable muscle sitting in sluggish circulation. Think about what happens when a muscle goes hours with less ideal blood flow, less frequent flushing of metabolic waste, less tissue motion, and more venous pooling. The muscle becomes easier to trigger. The nerves become easier to irritate. The entire region becomes more vulnerable to cramping sensations and aching sensations. In other words, the cramp may be real, but the reason for the cramp may not be what people think. The muscle is not always the primary problem. Sometimes the muscle is the messenger, and that is exactly why older adults get misled. The pain feels muscular, so they assume the cause must be muscular, But the body often expresses circulation problems through muscle discomfort before it expresses them through anything more dramatic. Let me give you another example. Frank was 72 and had just completed a long drive with his brother, several hours a day in the passenger seat. Knees bent, minimal walking, coffee but not much water. 2 nights after returning home, he woke with a sharp pain in the right calf. He shook it off, stamped the foot a little, stretched the leg, and blamed the drive. By the next evening, the right boot felt tighter than the left one. That detail matters. One-sided change is one of the most useful clues in this entire topic because ordinary nighttime leg cramps can happen in either leg. They may alternate. They may come after exertion, the dehydration or awkward positioning, but when you begin seeing a consistent pattern on one side, one calf, one ankle, one area of swelling, one area of warmth, one recurring nighttime pain, you should stop thinking only in terms of general cramps and start thinking about local circulation. Frank's daughter, who happened to be a nurse, noticed the right lower leg looked fuller than the left during a video call. He went in that day. Ultrasound found a clot behind the knee. He never developed a lung complication, and the difference between Frank and Margaret was not that Frank had a safer body. It was that someone noticed the pattern earlier. This is why I want to give you a simple framework. When you wake with a nighttime calf pain after 60, do not ask only one question. How fast did it stop? Ask 4 questions. First, was it one-sided? Second, did the area still ache or feel heavy hours later? Third, did the leg become warmer, fuller, or more tender than the other side? Fourth, has this been repeating in the same location? Those 4 questions are much more useful than asking whether the magnesium seemed to help, because the most misleading thing about a true circulation warning is that it often partially settles down. The person thinks, well, if it were serious, it would still be severe. Not necessarily. A clot does not need to scream to be dangerous. Venous congestion does not need to be dramatic to be real. And arterial insufficiency does not need to make the whole foot blue before it starts affecting the tissues. Now let's widen the lens, because not every circulation-related calf pain at night is about a clot. Some it points to poor arterial supply rather than blocked venous return. That is a different plumbing problem. The veins bring blood back up. Arteries deliver blood down. If the arteries in the legs have narrowed over time from plaque buildup, the tissues may already be living closer to the edge than the person realizes. During the day, some people first notice this as calf pain with walking that eases with rest. But at night, especially when the legs are elevated a certain way or the circulation is already poor, they may notice cramping, aching, coldness, numbness, or restless discomfort. This is one reason it is so dangerous to reduce all nighttime leg symptoms to a single supplement deficiency. The physiology is more complex than that. The older legs can hurt at night because blood is pooling too slowly in the veins. Older legs can hurt at night because blood is not arriving efficiently through narrowed arteries. The older legs can hurt at night because inactivity has allowed swelling to build in tissue that is already under strain. And yes, sometimes older legs cramp at night because of straightforward muscle irritability, medication effects, or true dehydration. But the only safe way to think is to respect the pattern, not the assumption, the now. I want to tell you about Dolores. Dolores was 66 and 8 weeks out from hip surgery. The procedure had gone well. She had done her rehab. She had progressed from walker to cane. She was proud of how much better she was doing. The prescribed blood thinner had ended. She felt like the high-risk part of recovery was over. Then the nighttime calf pain started, same side as the surgery. The same general hour. 3 nights in a row, that repetition should always make you pause. Random cramps are random. Meaningful symptoms often repeat in patterns. Dolores mentioned it casually at follow-up, almost as an afterthought, and her surgeon sent her for imaging that same afternoon. A small clot was found early. Treatment started before it became an emergency. What makes that story important is this. The many older adults think clot risk ends when they are walking again. Not always. After surgery, after illness, after travel, after periods of forced sitting, the body can remain in a higher risk state longer than people assume. The leg may look almost normal. The person may be functioning well, but the deeper physiology may still be catching up. So now let me give you the bedside check I want you to remember. If you wake with a sudden calf pain during the night, and you want to think clearly the next morning, compare the painful leg to the other one in daylight. Look at size. Does one calf or ankle look fuller? Look at color. Is one side redder, darker, or oddly pale? Feel temperature. Does one calf or foot feel warmer or colder than the other? Feel the texture of the pain. Did it behave like a brief knot in the muscle that released, or is it still a deep soreness, heaviness, or tight ache? Notice whether the pain has a local identity, one spot, one side, one repeated pattern. That kind of comparison matters because memory lies, the eye forgets. The body normalizes change very quickly. But side-to-side comparison reveals what memory smooths over. Now I want to talk about prevention, but I want to be careful here. No home routine can diagnose a clot. No simple trick can make a dangerous symptom safe. And nothing I say here replaces medical care when a leg becomes swollen, hot, painful, or different in a way that persists. But there are sensible habits that reduce the conditions that make nighttime calf problems more likely. The first is restoring the calf pump before long stillness. Before you go to sleep, and again if you wake during the night, do a short series of ankle pumps in bed. Point the toes away from you. Then pull them back toward the shins. Point, pull, point, pull. Do it slowly and fully for 15 to 20 repetitions. Why does this matter? Because that motion contracts and releases the calf muscles, mechanically helping to push venous blood upward. It is one of the simplest ways to reactivate the second heart without getting out of bed. Hospitals teach versions of this to patients after surgery for a reason. The second habit is being smarter about hydration timing. A lot of older adults do the day backwards. They underdrink through the morning and afternoon, then try to catch up at dinner, then cut off fluids completely in fear of nighttime bathroom trips. That pattern often sends them into bed already behind. You do not need to flood yourself at night. In fact, that may make sleep worse. But entering the evening chronically underhydrated sets the stage for thicker blood, drier tissues, and more irritable muscles. Better fluid intake earlier in the day is much more helpful than trying to rescue the problem at 9:30 at night. The third habit is reducing long stretches of immobility. If you spend evenings in a recliner, or watching television in the same position for hours, or sitting with the knees bent and the calves inactive, understand what that posture does physiologically. It quiets the calf pump before bedtime even begins. The body does not divide the day neatly into safe sitting and dangerous sleeping. Sluggish circulation accumulates across both. And that brings me to one of the overlooked patterns, the recliner problem. A surprising number of older adults sleep part of the night, or all of the night, in a recliner because of reflux, back pain, the congestion, or comfort. But sleeping for hours with the knees bent and the back of the calf under pressure creates the exact sort of mechanical stagnation the leg does not like. The veins behind the knee do not move blood as efficiently in that position. The calf pump is silent. Tissue compression adds one more obstacle. If someone must sleep that way, it becomes even more important to move the ankles, change position when possible, and take one-sided calf pain seriously if it begins appearing. Now I want to tell you the single most common mistake well-meaning people make when they hear a loved one cry out with a nighttime calf cramp. They massage the leg deeply. They dig their thumbs into the muscle. They knead the calf hard. They treat it like a knot that has to be worked out. And for an ordinary cramp, that may do no harm. But if what is sitting in that calf is not a harmless cramp, but a developing clot, or an inflamed deep vein, aggressive massage is exactly the wrong instinct. A persistently painful, swollen, warm calf is not something to knead. It is something to evaluate. So here is the safer household rule. If the pain is a brief sudden spasm and then fully resolves, gentle stretching is reasonable. But if the calf remains sore, looks fuller on one side, feels warm, or keeps repeating night after night, no deep massage, no forceful rubbing, no let me work it out. That is when you step out of home treatment thinking and into medical thinking. And now let me say something directly to the person who prides themselves on being tough. A lot of older adults delay action because the symptom is not dramatic enough to justify attention. They do not want to overreact. They do not want to bother anyone. They do not want to be the person who goes in for nothing. But the cost of getting checked and being told it was just a cramp is inconvenience. The cost of ignoring a one-sided circulation warning can be something else entirely. That is the arithmetic. You are not weak for paying attention to a leg that has changed. You are wise. The body is often courteous before it is catastrophic. It gives hints first, asymmetry, warmth, a deeper sock mark, a calf that aches the next morning, a foot that looks slightly different, a pain that keeps returning at the same hour in the same place. The tragedy is not that the signs are invisible. The tragedy is that they are visible, but familiar enough to dismiss. So here is what I want you to remember. After 60, a 3 a.m. calf cramp is not always just a cramp. Sometimes it is a muscle complaint caused by a circulation problem underneath. Sometimes it is the earliest visible warning that blood has been stalling in the leg. Sometimes it is the body showing you, in the middle of the night, that the second heart has gone quiet and the plumbing is under strain. And the best response is not panic, it is attention. Compare both legs. Notice one-sidedness. Notice duration. Notice warmth. Notice swelling. Notice repetition. Notice what the pain feels like the next morning, not just what it felt like at 3 a.m. If the pattern sounds like what we talked about today, make the call. Especially if there is one-sided swelling, warmth, persistent tenderness, or new shortness of breath, chest pain, dizziness, or a racing heart afterward. That combination is not something to explain away. Margaret thought the cramp was the whole story. It was not. It was the beginning of the story. Now you know more than she did at 3-7 in the morning. You know that older legs live at the far end of the circulation system. You know that the calf acts like a second heart. You know that when it stops pumping during sleep, blood can slow dramatically. You know that age, illness, travel, surgery, immobility, and dehydration all make that slowdown more consequential. And you know that the word cramp should describe the sensation, not replace the investigation. So tonight, before you go to bed, do 20 ankle pumps. Tomorrow, if your calf has been speaking to you lately, look at both legs in good light. And if what you see matches the pattern we talked about, do not wait for the body to become louder before you believe it. Because after 60, the pain that wakes you at 3 a.m. may not be a mineral problem. It may be what happens when blood stalls at night.